Afternoon. My name is Mr. Vijay. I'm a registered licensed mental health counselor, and also I'm a registered assistant medical officer. I put in almost 37 years in government service in Ministry of Health, and I continued my career into psychiatry or psychological medicine section. So I did my diploma in counseling, district master Malaysia, and continued my degree in psychology also in UK. Then I finished my masters in counseling from Open University of Malaysia. We are running a nursing home called Sai Satya Kasih Nursing Home in Ipoh. We specialize in taking care of people with emotional, psychological, mental problems. So we have started this home since 1987. So we cater for mostly all patients who got mental illness, psychosis and neurosis, suffering from schizophrenia, mood disorder, the major psychosis, schizophrenia, mood disorder. Of course, under the section we have depression, other illnesses. So neurosis, we have anxiety, panic attack, hysteria. Reason people suffering from mental illness, one is idiopathic, unknown reason. We don't know what is the reason. So another reason is it run in the family, hereditary. Organic causes. People who got some injury, trauma to the brain will have this problem. Later they suffer. And also something drug-induced psychosis. Patients who are involved in taking drugs, alcohol, substance abuse. Over the time, they suffer psychosis. So these are the three different components of this illness. We have received patient as young as 10 years old. So behavior problems, and then we had a patient, the oldest patient about 80 years old, who was having dementia, and another patient had Alzheimer's disease, schizophrenia, and then mood disorders. And we also have patients who have undergone drug rehabilitation. So they went back home, they couldn't cope with the public because the public don't accept them. So they had some antisocial activity involvement and all that. So family members cannot stand their behavior. So they send the patient here, so we are managing them also. So right now we have a patient who is suffering from diagnosed as schizophrenia, mood disorder, substance abuse, and also we got a patient who had injury to the head, post-traumatic psychosis. So these are three main, but majority are suffering from schizophrenia. So under the schizophrenia and mood disorder, we have a few patients who are suffering from depression. Severe depression, sometimes patient will tend to commit suicide. They feel life is not worth living. In fact, we had a patient here who had committed suicide by hanging himself using an old towel and hanging himself. So these are the things. But most of the patients here are seen by us. We counsel them, and then we take them to normal follow-ups to government hospitals, where the psychiatrists will see them, and then the medication will continue to do that. These illness, if you treat them from beginning itself, you can bring them back to almost 80 to 90% to normal life. If you detect early, you start treatment, we can bring them back to that percentage. If you don't treat, sometimes you detect the abnormal behavior at home. Some of our culture, they think some external power has entered their body. Even Malays believe ada orang raso, Chinese also believe that. So they try to go for traditional treatment, seeking for the Bobo treatment, sincere treatment. Our Indians look for some Sami and all that. So they spend, some of them spend a lot of money. At the end of the day, they couldn't do anything. There is a time where this Bomo and this Samia refer the patient, tell the family members, okay, take them to hospital. I think we cannot do anything anymore. So we have seen cases like that also. But if you treat them from beginning, from initial stage, with the proper medication, proper dosage and all that, we can bring them to almost, as I said, 80% to 90% to normal life. But saying that once you are on medication, patient must be continue this medicine for lifelong. It's not like you're having fever today, you put them on Panadol for 1 week, after the fever subside, you can stop medicine. It's not like that. It's lifelong. So regularly must see a follow-up with the doctors, and then some patients will be on oral medication, some patients will be put on injection depot. Monthly they need to go and see a doctor and get injection. So there are two types of medicines. One is oral medication, one is depot injection type. If they are regularly on medication, they will maintain very well. Okay, they will maintain very well. If the default medicine, possibility of the illness to relapse is very great. We have patients who have gone back home very well. After some time they come back. And that's why family members will complain, dia mari balik rumah, tak nak makan rumah, so sudah kacau balik. They will say that, even Indians will say lah, வீட்டுக்கு வந்துட்டாரு வர சாப்பிட்றாரு கேட்டால் உனக்கு தான் சீக்கிரம் இல்லை. This kind of things. So the important thing is, once you go back home, you must continue to take your medicine every day, okay, without fail. Then you can maintain a normal life. Important is the family members' role here. Once patient discharged home, family members' responsibility to take care of them. Most of the patients here, not really, family members come and visit them. Very few of them come. Some of them never come for years. When you call, ask them, they say they're busy, they work, no time and all that. But family members play a very important role for the patients to go back to the normal community, go back to the family. So the family members play an important role. They must make sure that this patient take medicine regularly. If they see any abnormal behavior, immediately they must take the patients to see a doctor at the nearest clinic or nearest hospital, so that the medication can be reviewed and proper advice can be given to the patients. In psychiatry, not only treatment but also one of the component is occupational therapy, where you train patient to do some handwork and all that. There will be a gardening. There will be, if in a central hospital, they have a farm. They rear chicken, they rear goat, they plant vegetable. Then patients will sell these kind of things to staff and all that. So here, in fact, similarly here also we have a chicken farm. We got few goats. We allow patients to take care of these animals, feeding them, taking them for grazing the grass and all that. So we train. Why we are training this way is because once they go back home, at least they know how to sustain, stay in the house without any problem. If the family members got any goat and all that, they were able to take care. If they got chicken and all, they were able to take care of the chicken. At least they occupied their time. Otherwise, if they are not occupied, their mind will be wandering around. So the relapse, very fast the relapse will set in again. Earlier here we used to, the company, the light company used to send the component of a fluorescent tube light. So the tube light, the body will settle by themselves. The wiring inside component, the starter, the wiring, the connection and all that, we assemble here. But now for some time the company stopped operation, so we are not getting a proper this thing. So we appeal, I like to appeal to any small, medium company who can send their goods. Maybe we can assemble them and send them back. So part of therapy for our patient, activity, keep them occupied. Otherwise, if you don't have activity for them, they will be, the mind will wandering. So the relapse will set in very fast. Depression is actually in psychiatry. Depression is one of the major illness to tackle. Now the WHO found out depression, deaths due to depression is number 10 in the world. First is heart attack. So depression set number 10th place. What is the cause of depression? There have been so many factors are involved in depression. Financial factors, family problems, love matters, okay, stress related to working environment. Someone passed away, loved one passed away. A week we'll be a bit upset and all that, sad and all that. That one we just give the night they finding it difficult to sleep and all that. So we give them some sleeping tablet, 1 2 weeks, they'll be settled. So there'll be sometime moderate depression. Moderate depression sometimes due to working situation, work stress, boss giving too much of work, cannot adjust themselves in working, so much demand, work pressure. So that one is a moderate depression. Severe depression, suppression in the family, divorce taking place. Financial, very severe financial problem. This one all will cause major depression. In fact, failure in love also will cause severe major depression. Some signs and symptoms. Initially, you can see for depression, patient they'll be normal, very normal. Suddenly, you can change in their behavior. They like to isolate themselves. If you're a cheerful person, suddenly they become quiet, lock themselves in a room, refuse to come out, refuse to meet friends, refuse to meet people, and refuse to eat, and then people, male refuse to shave and all that, keep long beard, don't want to keep very unkempt and all that. When you go near the smell, they feel life is not worth living. They will make a few attempts to commit suicide. Some males will go for excessive drinking of alcohol and all that, so that by drinking alcohol they think that this problem will be settled and all that. So these are some of the factors will cause. If you are able to detect depression early stage, you can treat them. A lot of now new drugs in the market, so you are able to treat the depression. But you must detect the depression early stage. And then you put them on proper medication, proper dosage, you can able to bring the patient back to the track again. If you neglect, then of course it's quite difficult to. There are two ways. One, you give oral medication, and then if severe depression, the new method is they give ECT, they call electroconvulsive therapy. So they give a shock current for a few seconds, 2-3 seconds, jerk, the patient have a convulsion for short while. After that, they'll go quiet. After 2 or 3 sessions of this ECT, patient, you can see some changes in them. Sometimes after the ECT, patient go down the hill, they never recover, they remain like that for forever. Most of the patients will recover after ECT. So if they have the problem persists, then need to put them on a higher dosage and all that. But mostly, if you take early, you put them on medication, they will come back. We have few patients who are depressed and all that, but they are maintaining well. Problem is family members not able to take them back, so they are here. So otherwise, depression will take early, you can able to treat them. This mental illness, it's a taboo in our general public. The moment someone in your family, say they admitted to hospital Bhagya, family members doesn't want to tell others, my so and so admit to hospital Bhagya. They feel, it's a sort of a status thing. You admit to hospital Bhagya, Tanjaramuttan means they look down and all that. And then public also have wrong perception about this illness, the stigma, mental patient. The moment once you go to hospital Bhagya, you come out, apply for any job also, they 2-3 times they think, they refuse to employ them and all that. But this illness, as earlier I said, if you detect early, you treat them early, give proper treatment, patient can function as normal as any other patient. We have seen patients, came here, admitted, they are doing very well now, no problem. They are doing very well. In fact, I can quote, but I don't mention name, a prominent caterer, prominent caterer. was very ill, and then was treated, admitted in hospital, treated very well, and he dedicated, he committed that he must take medicine in order to lead a normal life. In fact, the family members are very supportive of him, and he's doing very well. He's driving a Mercedes car now. So to that extent, in fact, brand new Mercedes car is driving now. So it shows that if you properly take care of yourself, properly medicine and all that, regularly see doctor and all that, you can able to lead a normal life. So people like you all, like Ishwari and all that, comes from the Open University, Wawasan Open University, taken trouble, lead to create awareness among the public, mental health illness is not a serious illness as some of them think. They are like normal people. If you detect them early, you give proper treatment, they also will be lead a normal life as normal people. So we want more people, to come support this mental. So we want more group like Ishwari's group, come forward, become sort of support group. You come and visit them. I think you have seen by yourself how cheerful patient when someone come and talk to them, So they are definitely very happy. So we like more groups come and participate in these kind of activities. So there is be part of the patients will be part of the society and all that. So there is no stigma. Mental illness can be treated. There is no issue. Not like those days. People think it's Satan entered the body. The way those days they treat, they torture the patient and all that. Nowadays modern treatment. Those days, all the moment you send to hospital, they keep them for longer. 6 months. Even some patients are staying there for years. Not able to go back. But nowadays the policy is you come in within 1 week, 2 week patient will be discharged. This family member is responsible to take up his patients, so that the stigma will be tried to able to we can eradicate the stigma. But of course the stigma will be there, But slowly, people like you all, do this kind of activity, slowly they look very normal. You see, when you don't see, you thought, oh, mental hospital, you have different perception of it. And you come and see them now, see how you feel, your perception about them will change, isn't it? So this is how the stigma will erase from that. So another thing is the psychoeducation is very important. The moment patients go back home, in fact we also teach patients, and once the moment go back home, the most important thing is we ask patients what you must do when you go back home. Some will say, I will do this, I will do that, but they won't talk about medicine. But we emphasize, the moment you go back home, the important thing is must take medicine every day. And every month, you must go and see your doctor in order to keep yourself, normal. If you don't take medicine, maybe 1 month, 2 months will be okay, After that small problem comes, you cannot settle, then, you have some, your mind will be wandering or that. So the illness will come back again, relapse set in. So you must take medicine regularly so that you maintain. Sometimes they, small things, they will lose their temper, and they become very aggressive, very difficult to control by one person. They have a history and all that. Patients, out of anger, they take some heavy object, hit their parents. Parents are died and all that because out of anger. If they take a medicine, they will control. So it's very important is medicine and the rehabilitation programs. Like today, you all came, did some telemedicine and all that. Very effective way of rehabilitating patients. It's now we're given art and all that. It's art also, art therapy. Sometimes a patient will express their feeling through art. So there's some art therapy experts and all that. They will able to interpret what patient trying to tell. Sometimes patient can't talk. So they express by writing, drawing. So good. So we are able to see how patient can draw. Some of them are very good talent. So that is how things are going on. Thank you for the opportunity given. I must thank the university, Wawasan Open University. Students now take trouble come all the way from Kuala Lumpur. It's about 240 kilometers away. So they made all the preparation. Extend my heartfelt thanks to Ishwari and the team members. Thank you very much.
God is experience because when I was young, my childhood was very bad. Because I had this skin problem, this dry skin problem, it looks like something like a snake skin. And then I had this squint eyes, very bad squint. So when I went to school, when I started going to kindergarten, the children were like, they didn't want to talk to me, they didn't want to mix with me. If I go near them, they ask me to just move away because they say the skin, you got snake skin, it was spread, and then they say they also make fun of me, where are you looking where, and all the things. So it really hurts me so much. Once I went to the playground, I was playing there, I was like very lonely, I was playing there, one small Punjabi boy, I can't remember his name. He didn't like me I was on the slide, he pushed me down. I got injured and I got fractured in my arm. And all these things is happening all the time. When I was in standard 1, standard 2, the same thing is happening. They're bullying me, they don't make friends with me, and they always tease me. So I felt very lonely. Because of this, I think is the main factor I got is mental illness. So I think in school, children shouldn't be bullied like this because of this bullying. You see what happened in my life, I'm already 56 years old, and you see my life is just like this. I'm an intelligent person, and I ended up like this. I think it's a sin to bully somebody because their life is being ruined. I got this illness exactly when I was about 18 years old. When I was traveling to Singapore, on the way back I got this attack. Then I was admitted in the university hospital. I stayed there for 2 weeks. Then they diagnosed me as schizophrenia. Then later on I went back to Ipoh. I'm supposed to come back at university hospital for treatment. My parents were too old, so they couldn't bring me there. Then I had a relapse. Then they sent me to Tanjung Rambutan Hospital.
Okay.
Yeah, another 18 years old. When I was 18, I went to hospital. After treatment, about 2 months, I came back home. Then I was at home doing my normal things. Then I got a relapse again. After about 10 years. Later 10 years, I went back to Tanjung again in 91. Then after another 10 years, I recovered. Then about 2002, I had a relapse. Then I went to Tanjung. I had a Tanjung again. And after that, when I went to Tanjung and then came back, after a few months, I had another relapse in 2002. So after that, I was sent to the home. Till now I'm here, 18 years in the home. But in different homes.
In the third year, I flunked 2 out of the 5 subjects which I took. And then anyhow, I went on to year 4, and then at the same time I resit for the 2 papers. And lucky thing I cleared on time and graduated. Year 1990. Electrical and electronics, specializing in control and automation, study robotics all this. I study in NTU, Singapore, Nanyang Technological University of Singapore. I think I got it during my university time. Due to all the stress, and in the first year I got break up with my boyfriend, and I became very self-conscious, things like that. There were people talking about me. At that time, maybe I already got the illness, but I didn't realize it. And then when I come back to Malaysia, and then I went to KL and work, and then I had a lot of problems with people, things like that. And then my parents, they see me and then they say something wrong with me. So they advised me to go to see a psychologist in KL. And then the psychologist diagnosed that I got schizophrenia. So he put me on medication. For 2 years I ate and I got well, and then he said you're free to go and work or study whatever you want. So I stopped medication there, and then in 2002 I had a relapse. GH in KL. In KL I stayed there for 1 month or so. Then I went home. I don't remember what I did. You know, I help out with my father's business. Finally, in 2010, I committed suicide, you see, at home. So my parents, my family decided to put me up in a nursing home for good. Don't let me go home or holiday or what. So I stayed there until from 2010 until last year.